Okay, and 3, 2, 1, go ahead.
Good morning.
Good morning, doctor.
I'm Dr. Emeka, one of the doctors here in the clinic. May I confirm you are Mr. Sanders, 53-year-old?
Yes, doctor, I'm Sanders. I'm 53 years old.
Okay, pleased to meet you.
Pleased to meet you.
All right, I understand you have been having this pain in your face. Can you throw more light concerning the pain?
Yes, doctor. I have severe pain. It started like a numbing pain and it is growing more and more, going more and more in my face. And I'm really concerned about it. And I tried
Oh,
taking some paracetamol or anything, but that's not helping me. That's the reason I came here to get to know the bottom of it.
so sorry to hear that. This must be really difficult for you. But not to worry, we'll see how we can do to assist you in this pain. Is that okay?
Yeah, that's perfectly fine, doctor. No issues.
All right. And this pain you complain about that started with numbness, for how long now?
Doctor, this facial pain, I just noted around 6 months back. Now the pain is very severe.
6 months. Wow, that's a long, quite a long time. And you said you have been taking paracetamol, right?
yes, tried taking paracetamol. It just gives like a 5-10% relief.
Oh. Do you know of anything that you take, you do that make the pain worsen, and anything that you do that make it goes away?
Only thing I tried is paracetamol. I tried giving this hot fermentation, with the hot water or soaking cloth over there. And I tried applying some balm over my face, and nothing was helping me. The pain was severe, doctor.
Oh, so sorry. If you are to tell me the severity of this pain, one being the lowest, 10 being the highest pain you've ever had, which number will you place this pain?
I will now place the pain around 6 to 7.
Wow, that's quite high. Okay. Do you notice the pain gets worse when you try to shave your hair?
No, 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 nothing like that.
Okay, what about when you're brushing your teeth in the morning? Does it get worse?
No, doctor.
Okay, do you know of anything that does the pain spread from one part to another?
It doesn't spread anywhere. The pain is in its place.
Okay. If I may ask, so I want to ask some specific question, if you don't mind.
Yes,
Do,
sure.
do you have any do you have any swelling on the face there?
I mean, like slight swelling is there, doctor.
Okay. Does the swelling, for how long has the swelling been there?
That swelling has also started within the 6 months only. I started noticing. Initially, it was there. There was a pain, but I started noticing some swelling in the face as well, along with the pain, doctor.
Okay, and it's getting worse too, right?
Yes, doctor.
Okay, have you had a similar pain and swelling before in the past?
No, doctor. No, doctor. Never, doctor.
Okay, and then does this pain does it affect you when you are chewing?
Yeah, I mean, I don't have any problem with chewing or anything, doctor, but the pain is there.
I didn't get you. Sorry.
I mean, I don't have any problem with the chewing, but the pain is there.
Okay. So, do you salivate often?
No, I just salivate like any other person. I mean, I don't salivate often, just like any other person.
Okay. So, do you have any dryness of the mouth?
I don't have, doctor.
Okay. Sorry. Okay. Do you have any headache?
I don't.
Okay. Any neck pain or neck stiffness?
No,
Any blurring of vision?
no,
Any dizziness?
no,
Any loss of consciousness?
no,
Any seizure?
no,
Any neck pain?
no,
Any problem with your swallowing?
no,
Any neck swelling?
no,
Any hot or cold intolerance?
no,
Any weakness of the body?
no,
Okay. Any pins and needle sensation of the body?
no,
Any joint pain?
no,
Any tightness of the skin?
no,
Any lumps and bumps?
no,
Any rash?
no,
Any loose stool or constipation?
no,
Any tummy swelling?
no.
Any pain in any other part of your body outside your face?
There is no swelling any other part of the body outside my face.
What of pain? Any pain in other part of the body outside the
No, no,
face? Any pain?
no
Okay.
part of my body has pain.
Okay. Do you have any? Do you feel heart racing?
Hot. I'm not getting you. What,
Yeah.
doctor?
Do you feel your heart raising? Do you have any raising of the heart?
No, my heart is not racing, doctor.
Okay. Any cough?
No,
Any shortness of breath?
absolutely not.
How is the water works like?
My waterworks are declined.
Wow, so sorry. For how long?
Doctor, it's been declining for the last 3 hours, 3 years. I mean, like, it just started declining the last 3 years. And now it is completely like, I'm just passing like less than 500 ml.
Oh, so sorry to hear about that. Are you having any condition that's any condition outside this one you're having, outside this facial pain and swelling?
You mean to say symptom?
Like like any have you been diagnosed of any condition before now?
Yes, doctor. I have diabetes. I have high blood pressure. I have high cholesterol. I have kidney disease.
Okay, so for let's take it one after the other. For the diabetes, for how long have you been having the diabetes? How many years?
I have been having diabetes for the last 22 years.
Wow. Are you on any medication for your diabetes?
I am on insulin.
Okay. What else?
I'm on insulin and I'm on, dapagliflozin.
Okay. And is the condition with diabetes well controlled?
Kind of, doctor. Some months it is controlled really well, and sometimes it is not controlled. It just fluctuates between controlled and uncontrolled diabetes.
Okay. When was the last time you checked your sugar level?
3 weeks back,
Okay, and what was it, if you don't mind?
13. 3 monthly blood
13.
level is 13.
13, that was quite high. Okay. Then for the hypertension, can I have your list of medication for the hypertension you have been taking?
Metoprolol.
Metoprolol. Okay. What else?
That's it.
Okay. Is your BP controlled?
Yes, doctor. It's somewhat controlled. It's like 110, sometimes 130. It never exceeds 130.
Okay. Then for the Thank you. Then for the for the hypercholesterolemia, you have had the lipid. What medication are you taking for the lipids?
Statins.
Statins. Okay. And yeah, when was last time you had your liver function, your lipid profile checked? Was it normal?
Yes, it's normal.
Okay. Then for the chronic kidney disease, are you on any mode of replacements you have been using for the chronic kidney disease?
Yes, doctor. I have been undergoing dialysis.
For how long now?
It's been 1.5 years.
Oh, okay, okay. And when was your last dialysis section?
Last week.
Last week. So for the past 7 days, you've not gone to dialysis, right?
Yes, doctor. Last week I
May I
went.
know?
This is
Okay,
doctor. 8 minutes over. Okay.
okay. So okay. All right. Do you have any past medical history?
That's what I
Any
told.
past surgical history?
No, I don't have, doctor.
Okay. What of do you have? Do you have any family history of similar condition?
Nobody in my family has this condition, doctor, as far as I am aware of.
Okay. And do you smoke?
Yes, I do smoke.
Okay, you may need to cut down your cigarette smoking if you don't mind.
Yes, doctor.
Okay, so I'll have to refer you to the smoking cessation to stop your cigarette smoking. For how long can I know this? For how long have you been smoking? How many sticks of cigarette have you been smoking per day?
Yes, doctor.
For how long have you been smoking, and how many sticks have you been smoking per day?
I smoke around 5 to 10 sticks a day, doctor.
Okay, you may need to stop. Okay, then for the alcohol, what is the alcohol consumption?
Alcohol, like very rarely, I just take a glass of beer. That's it.
Okay, all right. Then also, if you don't mind, what kind of job do you do? What kind of job do you do?
Doctor, I am working as a financial analyst in a business.
And okay, so and has it affected your job, your condition?
Yes, of course it is affecting, doctor. I have constant facial pain. I have to speak to my clients. It's really disturbing me.
Okay, I can see. So we'll see how we can address that by sending a note to your manager so they can spare you off some days for us to attend to you. Is that okay?
Yeah, that's perfectly fine. Thank you, doctor.
What's your family? How is the family like? Are you coping with your family? Are they helping with your situation?
Yes, doctor. My family is supportive. I'm just coping up with the situation.
Okay. Do you mind if I examine you?
Okay, sure. Pleasure, doctor. You can go.
Okay.
You are starting the
Okay.
examination at 10 minutes. Okay.
Okay. So I want to look at your. Can I see your hand, please?
Yeah.
I see
Yes.
the hands. Check anything. Anything in the hands, and is there any finger clubbing?
No
Look
clubbing.
at the any tryptophan contraction.
No.
Okay. Look at any CGM, any glucose monitoring device in the arm.
No,
Look at
nothing.
okay. Then look at the BP. Check the blood pressure, the pulse. The
Blood
JVP is elevated.
blood pressure is normal. JVP is not elevated.
Okay. Any pallor?
There is no pallor.
Any lymphadenopathy?
There are no lymphadenopathy.
Is the heart displaced?
I'm sorry.
Is the heart displaced? The apex beat, is it displaced?
Apex beat is in its place. It is not displaced.
Okay. Any murmurs?
You want to auscultate the heart?
Yes, I want to study the heart for heart sound and
Yes,
murmurs.
heart auscultation is going to cost you 1 minute or 1.5 minutes at least in a man after removing
Okay.
that. His heart
Okay.
is normal. You have 1 minute left for examination.
Okay. I want to touch on I'm looking at the face and then feel it for do my the can you raise your hand up? I'm feeling the ear. Any rashes on the ear?
There is no rashes in the ear. This is his face.
Okay, there's swelling.
Well,
Okay. Okay. Is it tender? Is any redness?
there is no redness, but it is swollen.
Okay, then I'll look at check for the sensation. And is this sensation, is it the V1, V2, V3? Is it affected?
It is
Facial nerve?
it is normal. 20 seconds left.
Okay, then I want to look at open your mouth and see, check if there's if the gland is swollen and check for the lymph
You
node
want to
there.
see the mouth?
Okay,
See, this is his mouth.
okay, all right. Then okay, I've seen the mouth. Then the next I want to do is to look at ask if okay, do you have any concern?
Yes, doctor. I have a couple of concerns. What is happening to me, doctor?
That's a good question you just asked. Actually, looking at what you presented to me, and you have a background diabetes, hypertension, and lipids problem. You have end stage problem. Most and then the last time you went for dialysis was 1 week ago. Most likely some of the toxins in your blood, which we call urea, is affecting it's maybe what is causing this pain you're having that is worsening for the past. That is most likely making it to be worse within the past few days. However, the pain that you have in the left side could also be explained by some infection, which may be due to your immunity that has been your defense mechanism that's been down. So, but we'll see what you can do to diagnose it in no time. Any other concern?
Doctor, is it treatable? Will you be able to treat or cure this pain? It is really annoying me, doctor.
I can imagine how difficult the difficulty you are experiencing now. But see what you can do. We need to involve the nerve doctors to look at you, and then following that, we'll do our best to ensure that you are pain free in no time by giving some painkillers. How about that?
Okay, that's fine. And doctor, can you tell me, should I get admitted in the hospital or I can walk back home?
At this point in time, I'll discuss with my. At this point in time, I will give you some tests to do subsequently, and then looking at how it is now, we may need to check your other involvement like the eyes and see if it's really affected.
Okay.
Then we need to give you some appointment to come and see us later with the results.
Okay, your time's up. Can you tell me your positive physical findings? Only positive, only physical finding, not in the history.
Okay, not in the history. There's on examination, I noticed is having swelling in the right face.
Swelling in the right face.
Which was tender.
Anything else?
It was tender, and then there's the teeth is appeared. There's gingival aplasia.
Gingival hyperplasia. Okay.
Then with some sores. There's dental inflammation, dental caries.
Okay.
Dental caries.
All right. Can you give me, doctor, 3 differential diagnoses with the most probable diagnosis on the top to the least probable diagnosis in the bottom? Can you give me just 3? 1, 2, three differential diagnoses, please.
Periodontitis.
Periodontitis.
Mm. Yeah, I'm looking at it.
Anything else? Please don't type any
And
answers till he finished, doctor.
then also looking at parotid gland enlargement.
Parotid
Yeah.
enlargement. Okay.
That's a parotid tumor and gland. Yeah.
Anything else?
Parotid. Then okay, I mean just go with what the last person that pasted, amyloidosis.
Amyloidosis.
Yeah.
Okay. Can you tell me the specific investigation you are going to do for me? I just want to hear only the specific investigation. I don't want to hear any ESR, CRP, LFT, and pulmonary function test, like, unrelevant investigation. PACES exam also modified based on that. Only the specific investigation. I want to know what exactly you are going to look for in the specific investigation. That means you have to justify your investigation. Okay, please go ahead, doctor.
Okay, now I want to do an X-ray of the face, and then this the X-ray and ultrasound scan of this X-ray and ultrasound scan to delineate if there's any gland that is inflamed.
Okay.
And also want to do ESR and CRT protein inflammatory markers. I also want to do full blood counts and differentials to see if there's any inflammation. Yeah, to see if there's evidence of leukocytosis.
Okay.
Then I want to check the urea level of urea and creatinine.
Okay.
Then check this. Then now, and in this case, since I'm thinking of amyloid, I also want to check for the do a biopsy of fat pad biopsy to check for to check for Congo red stain.
Congo red stain for amyloid. Okay, yeah. Okay, fine. So how are you going to treat this patient? Suppose this patient is there, you are the registrar in the nephrology ward, and okay, he's coming with the swelling, sir, after it. Like, so how are you going to treat him?
I'm going to involve the MDT, which will involve the nephrologist, the gland doctors, which is the endocrinologist, and then the neurologist for the cause of the pain. Then also the ENT, the maxillofacial surgeons will be involved in this case, and the specialized nurse. And then as MDT involvement, then also we counsel this patient on cigarette smoking cessation. Okay. And then alcohol cessation. Then we'll treat this patient by ensuring that we antibiotics if there's any evidence of signs of infection, followed by if there's leukocytosis, start by giving antibiotics, a broad spectrum antibiotics for him, and then ensure he has regular dialysis.
Okay. All right. I'll just stop here. You have done well, you have attempted well. However, the differentials and the investigation, everything gone wrong. Okay, it's a tough case. This case came, and I don't want to mention the year or anything, the recent RCP standard, as per that I am abide by that. A similar case came, similar diagnosis, some long time back. Then there was a gap. Very recently, it is brought back. Of course, we have a lot of wonderful nephrologists around. They brought this thing. Okay, so I will tell you the differential. I'll explain to everyone. Physical examination, if you don't touch the abdomen of this patient, if you don't check the AV fistula, if it is there, and if you don't check the thrill in the AV fistula, if you don't check whether the AV fistula has been recently used, if you don't check for uremic plaque, and if you are going to auscultate this patient, I'm really sorry, you have done really well, it will become unsatisfactory. In a renal patient, these are the things you should be looking for. Starting from the fingers. Starting from the fingers, you should look for any leukonychia. From there, you go up and do all this examination. And AV fistula is missed, thrill is missed, needle prick mark, anything is there, it is missed, an abdomen examination missed. This will obviously become borderline. Your clinical history taking was extensive. You have taken up to 10 minutes, 10 seconds. Please don't do that. Always keep 8 minutes. You have addressed the concerns, giving variable differentials. Fine. You maintain the patient's welfare. It's fine. But however, the differentials in clinical judgment will go unsatisfactory. This will be your mark sheet. Now let us go and discuss the differentials before we discuss the theory, and we discuss the part of how to take appropriate history in general internal medicine. Let it be Mrcp, let it be MD, DNB, let it be Mrcp Ireland, let it be whatever it is. All right, let's go. What was the case? This case is a patient who is CKD, is diabetic, hypertension, dyslipidemia. He is on dialysis. Now he is having decreased urine output, bone pain. These are all giveaway clues. These are all giveaway clues. This should prompt something. Okay, this should prompt something to you, do some diagnosis. See, there is a growth in the maxilla. There is a growth in the maxilla. There is bone pain. There is severe bone pain. And I had a patient. In India, I have a patient, but that lady is unwilling to show her face or any of her issues. Otherwise, I would have taken the similar lady, a similar case with that lady. I would have posted the video itself, but she was unwilling. So I respected her privacy and I didn't forcefully take any videos or photographs of her. So what could be causing a bone pain in a patient who is undergoing dialysis, in a CKD patient? Obviously, you can blindly go for the very first, something to do with the secondary hyperparathyroidism. Okay, this is obviously secondary hyperparathyroidism. Renal osteodystrophy. Renal osteodystrophy. That's the thing. Okay, I'll come to that. There are a lot of differentials in renal osteodystrophy. Brown's tumor, adynamic bone disease, osteomalacia, everything we are going to discuss. This is a Brown's tumor, a type of renal osteodystrophy. One candidate, excellent answer she has given, that is called Sag-Leiker syndrome. You don't need to worry about that. You don't need to tell the syndrome names in PACES examination. If you can tell it's due to secondary hyperparathyroidism, that's the first thing I can suspect in a patient who is undergoing dialysis. That's more than enough. They'll be happy. They'll be happy. Definitely, you can be rest assured, periodontitis is not going to be asked for you. A parotid gland swelling is not going to be asked for you. That has been asked in only one unfortunate occasion. Pleomorphic adenoma has come as a case, and it received huge criticism. And amyloidosis less likely to present in this manner. All right, all of you clear till now? Any doubts? All of you clear till now? We are going to go and discuss the theoretical part of it. Okay, make sure any bone pain in a patient who is CKD, it's going to be secondary hyperparathyroidism. Is going to be the most common cause. It doesn't matter you're encountering this case in your examination, you're encountering the case in your day-to-day life, in your clinical practice. That's what we are concerned more about. Your PACES knowledge also should go up. Your MD, DNB knowledge should also go up. Your bedside clinical medicine knowledge also should go up here. Okay, no need to worry about tertiary hyperparathyroidism here. It's always going to be first, secondary hyperparathyroidism is the most common cause when it comes to a CKD patient here. A CKD, it's going to be secondary hyperparathyroidism. You can fix it in your mind. Then tertiary hyperparathyroidism, you can rule out only by investigation. All three will be elevated. Tertiary 3, T for T3, phosphate will be elevated, your calcium will be elevated, your PTH will be elevated. So these are the type of investigation I am expecting from you. Technetium scan, biopsy. CT scan, renal function test, EGFR, abdominal ultrasound, bone markers, FGFR. These are the thing I am expecting from you than anything else. That is why specific investigation matters. That's why I discourage people from going around and telling, stuffs like, I discourage people basically, stopping them from telling, stuffs like, CBC, ESR, LFT, RFT, blah, 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 like that. Don't tell. Be very specific. Examiners will be really happy than giving 10 investigation, 3, 4 investigation. For example, an ILD patient is there. Tell HRCT, I'll be looking for honeycombing or ground glass opacity. If there is a ground glass opacity, it is steroid responsive. You'll be happy. Wow, this guy knows what he is looking for in a patient. He's not a type of guy who's going to pull out his chat GPT, which he has subscribed recently, to ask the answer for. Okay, this is old bedside teaching because we are from bedside medicine. Our teaching are old style. Okay, so that's what you are expected to do. On history basis about tertiary hyperparathyroidism, we are going to discuss next week, doctor. Which case I will do it for you 100%. Don't worry. So renal osteodystrophy and the subtypes. I hope there is no doubt till now. First is osteitis fibrosa cystica. Next is your adynamic bone disease. 3 is osteomalacia. The fourth type is mixed uremic osteodystrophy. Next, there is another classification for this secondary parathyroidism in renal patients is TMV classification. That is turnover, mineralization, volume. This is based on bone scan. What is the bone turnover? What is the mineralization? What is the volume? Then, if you, 1 second, why this Zoom notification is obstructing me? Yeah. Risk factor for CKD. This is from Harrison's latest edition. I believe all of you have. You don't need to remember everything, but just remember 1 or 2. It's very important. Even a sedentary lifestyle is given as a risk factor. Preeclampsia is a risk factor. HIV is a risk factor. MTB is a risk factor. And diabetes, increased BMI, autoimmune disease, nephrotoxin exposure, all are risk factors. This is EGFR classification. If somebody asked last time to them on, just put it up. This is how they calculate 1.86 serum creatinine into age. This is the calculation. We have MD-Calc and other calculators are available. You can do. This is CKD EPA equation given there. Leading etiology of chronic kidney disease. Remember, diabetic nephropathy, glomerulonephritis, hypertension, and autosomal dominant polycystic kidney disease. So when you guys get a case in station 4, some renal case with a renal transplant, then examiner will ask, what do you think is the reason? Please don't go around, start telling amyloidosis or some rare syndrome, which is horseshoe kidney. No. Start with diabetic nephropathy, most common. Glomerulonephritis, second. Hypertension associated CKD, including renal vascular disease like renal artery stenosis, thrombosis, or anything. Then ADPKD. Okay. So what are the causes of secondary hyperparathyroidism in a renal patient? Declining GFR will lead to reduced excretion of phosphate. Okay. So what happens is that phosphate will return. The retained phosphate stimulates the synthesis of FGF23 by osteocytes and PTH. This stimulates the growth of parathyroid gland. This is the most important cause. Okay. Also, there is reduced expression of vitamin D receptor, calcium sensing receptor. Just remember this: decreased GFR, increased phosphate, increase FGF23, increase PTH. That's it. Next slide. So, okay, this is about this. So next week, again, we are going to see a similar case where I will explain the treatment for this. Okay, this week, without wasting time, I'm going to go to the history taking part. How to take a history in Mrcp UK examination or Mrcp Ireland examination, your Fcps, your MD-DNB. What is the most important components we need to cover? MD-DNB exams, you may have to do even more extensive history taking. Here, we are going to cover most of the things which you need. All right. Any doubt till now? Can I move on to the history taking session? There are no doubts. I will move on. Okay. All right. This is a series of lecture in renal medicine we are going to do. Okay. All right. Somebody ask us. Okay. All right. So what to do when you wait outside? You'll have palpitation, hypertension, dizziness, sweating, everything will be there. Pheochromocytoma symptoms. Once you're waiting outside, you will be given a piece of paper, A4 paper, and a pencil. FGF means fibroblast growth factor. Okay. So you'll be given a piece of paper and a pencil. So what you need to do when it is given to you, that matters a lot. So we have a format. This is what we suggest you to do. See, towards the right hand upper end of the paper, write down your possible differentials. 1, 2, 3, and 4. To the left hand corner, on the top you write IVAP. Doesn't mean I'm vaping or anything. IVAP means introduction, verification, agenda, and permission. That's a good question by someone. How much time given, how much exam and history we should divide? Yes, very good question. So 15 minutes given overall in your hands entirely. They will warn you when 2 minutes left. That is at your 13th minute. So my suggestion would be 8 minutes for history taking, 5 minutes for examination and with the patient, and last 2 minutes only for concerns and nothing else. So IVAP is introduction, verification, agenda, and permission. I'll come to that individually. CK is check knowledge. Please don't go and ask what has brought you in here or why you are here. No. Preparation time is 5 minutes outside, they will give doctor. Okay. Next is write history of presenting illness. Ask the specific questions. Only specific questions. Then past history with medication history, allergic history, over-the-counter medication, herbal remedy. Okay. This allergy is for both food and medicine. Once you have done, you will have a clue what you are dealing with. 100%. Trust me. After specific questions, go to the past history, you will have a clue. Then quick systems review. If you are not getting a clue, systems review, we recommend head-to-toe review. We recommend head-to-toe review. Then comes personal history, that is on smoking, alcohol, recreational drug, casual partners. If it is a female, triple P, pregnancy, pills, and periods. Then you go for social history and driving. Then family history and travel history. With the family history, you have to ask certain things. I will come to that. I hope all of you are clear with this because I'm not going to display the slide again. This lecture will be available in our channel in YouTube. I'm not going to display the slide again, okay? I hope all of you are clear. So what is IVAP and CK? Yes. You introduce yourself. I'm Dr. Sones. I'm Dr. Wesley. I'm one of the medical doctors here in the neurology ward here today. And is this Mr. Sanders, who are 35 years old? Yeah, good morning. Hello, Sanders. How are you doing today, sir? And Mr. Sanders, like I'm going to discuss about your health condition. I'm aware of the fact you have some facial pain and we're going to look for a way forward from here. And I'll be examining you. Is it all right with you, sir? That's setting the agenda, asking the permission. Just appear confident. Okay, then check knowledge. Okay, don't go and tell may confirm your name and age, please. No, that is waste of time. Just immediately know the name, Sanders or Matthews or whatever it is. This is Mr. Matthews, 53-year-old man. How are you doing, sir? That's it. Avoid any second wasting. All right, avoid wasting any seconds. All right, then go ahead is the history of presenting illness. Always ask specific questions here for specific complaints. Specific complaints have like pain. Don't forget to ask visual analog skill. The doctor beautifully asked that. For any complaint, ask about the onset, duration, progression, aggravating factor, and relieving factor. Specific complaints have specific questions. I am in no position to sit and teach every complaint and every question. This is just an overall format for your history take. For example, seizures, you can ask what happened before, during, and after. It's very important. Any injuries, any medication adherence, a female patient, any pregnancy. I'm just giving an example here. This is not the entire specific question for seizures. So history of presenting illness should be specific question. Once you have done, this is the head-to-toe review. You can take a picture of this. No problem. Whatever can happen from your head to toe is covered here. You have any headache, sir? I'll just show an example. I'm just setting the timer. I'll just demonstrate how fast I can finish this head to toe review. Okay, 0 0 seconds. All right, you have any headache, sir? You have any hair loss, any mood disturbance, any weakness at any part of the body, any abnormal movements you have, any shakiness or something, any disturbance in your vision? It should be very specific. Eye pain, redness, dryness, are you bumping into the objects? Any blurring of vision? Nothing. Any hard of hearing? Any loss of balance or dizziness like that? You feel throwing up? You feel sick? And any difficulty in pain during swallowing? Any sores in your mouth? I'm sorry to ask, any sores in your private parts? Are you uncomfortable with the hot or cold weather or weather preference? Any lumps or bumps anywhere in your body? Along with that, you can ask about weight changes. If there is a weight change, ask if it is intentional. And any shakiness of your hands, any shortness of breath or cough. That will give you a clue. Any chest pain or chest discomfort, any racing, pacing of your heart. All right. Any abdominal pain or discomfort, any bloating like that or tummy swelling. How's your bowel works? And how is your urine output, sir? Any frothiness, any bleeding, any blood in the urine, any pain while passing urine, any issues with the intimate relationship? Please ask in male patients at least. Any joint pain, swelling, rashes, any skin changes, any yellow discoloration of your eyes or skin? Did anyone told you're going pale? And any pins and needle sensation, any walking disturbance. That's it. What do you think is going to be asked beyond this? Absolutely nothing. You will come to a conclusion by this time. What is the diagnosis? There is not much diagnosis. It's simple. Okay. So then go about the past history. In the past history and medical history combined together, just you can ask certain things. Have you taken any medication for anything in the past, or are you taking any medication currently? This will give you the clue. If he is taking medication as the dosage, are you taking properly? Adherence, any change in the dosage, any side effects? This thing you need to ask. Allergic history, again, it's very important. Any over-the-counter medication, any herbal remedies, or did you underwent any procedure? Surgery is different from procedure. Okay. For example, a bone marrow biopsy or a lumbar puncture is a procedure. Surgery is different and procedure is different. So you have to ask this. Then medication history, I already told you. Any change in the dosage, patient adherence. Okay. Patient ever taken any medication? Ask about the usage of over-the-counter medication and herbal remedies. There was a scenario, I think, warfarin based scenario where herbal remedies played the key role. Then family history, any similar complaints in the family, one word. And if there is a heart attack or stroke or cancer, please ask at what age, even for cardiac arrest. Okay, because young age of onset should set an alarm to you. All right. Personal history. Number one, smoking. Ask how long, how many sticks a day. Quit. There is no cut down in smoking. You quit the smoking. Alcohol, quantify. The permissible limit is 14 units per week. If he is a binge drinker, okay, ask about cutting down and offer help from AA. Okay, offer help from AA. AA means Alcoholics Anonymous. AA means Alcoholic Anonymous. Okay, just a second. Sorry. Ask about any recreational drug, party, or drug usage. Ask about casual partner. If casual partner is present, ask about protected or unprotected intercourse, and ask about MSM, men sex with men. If there is a recreational drug is being used, ask about is it through blood channels, that is IV drug abuse. If it is present, ask whether any needle sharing is involved. This is very important. Then coming to alcohol, a lot of people have a confusion. You should know what is the definition of binge drinking. Binge drinking is when somebody having more than 8 units in a single setting is a binge drinking. Okay, binge drinking. More than 8 units in a single setting is a binge drinking. So, how do you know about the units? This can be confusing. 40% of absolute blood alcohol volume, 2%, 3%, half percent, 1%. How to understand the unit? That's what I'm coming to, doctor. I will make you understand the units of alcohol with in a simple way. I'll come to that. Okay, I think I have some empty page. I'll come to that at last. Okay, then personal history. I told you female periods, pills, and pregnancy is important. Okay. Then social history. Ask about what job is he or she is doing, and ask about the impact in job. It's very important. How does this impact? In elderly, ask who is taking care of them. If a patient has a driving history, ask what kind of vehicle he or she drives. If it is relevant, not in all cases. I've seen candidates asking somebody's having a cough, you should stop driving because you're having cough. You should stop driving because you have itch. Then no one can drive on the road. Okay. Don't stop driving unnecessarily. Specific conditions like visual disturbance, seizures, dizziness, hard of hearing, there are certain things you have to stop. Not for everything, you cannot go around stopping driving, stop driving, stop driving. No. Travel history. Travel history is very, very important. We will discuss the travel history in a specific session. Travel history need not be asked in every cases, but there are certain cases like, fever, loose stools, sometimes, in case you are suspecting a pulmonary embolism or a DVT, during the time you have to ask about travel history. Travel history is divided into 3 parts. Pre-travel, travel, and post-travel. I will post a short video on YouTube about travel history exclusively, okay? Because I'm a travel medicine practitioner as well. I got a diploma in that, so I will post that separately. Pre-travel, travel, and post-travel. Okay, now I'll just clarify. I hope all of you are clear till then. Any doubts till now? I'm going to clarify blood units and alcohol. Any doubts till now in the history taking?
No,
This
sir.
is available in the YouTube. You all can watch. You can download also from YouTube now. YouTube videos are download. There are no doubts. Can we go and discuss about
No, sir.
alcohol? All right. Festival time, weekends, time to discuss about alcohol. Alcohol we divide into 3 drinks. Hot drinks, beer, wine. What are the hot drinks? Whiskey, brandy, rum, white rum, dark rum. Digestives. What are digestive? The drinks that Germans use, like, this Jägermeister, are all digestives. Then what we are missing? Vodka, gin. Anything else are we missing here? Anyone? Anything if you are missing, please, you can enlighten me if I'm missing anything in the hot drinks. Then beer. Okay. And you can also add this, country liquor. Country liquor is as dangerous as tonic. Yeah, tonic is gin, doctor. Gin is what we call as a tonic. This London dry gin, whatever it is, that's a tonic. Then coming to beer. Beer can be your lager, or sometimes in India we have this strong beer is available. Again, wine can be three, red wine, white wine, and sparkling wine. These are the things. So how much a person is allowed to drink? Both men and women are equal. They can drink 14 units per week. 2 units per day, or at least spread over 3 to 4 days. All right. So what is this 2 unit comprises of? Okay, sorry. What is this 2 unit comprises of? 14 units per week. So what this 2 unit means? Okay. What does this 2 unit means? That's what I'm going to tell you. 2 unit is equal to, in a hot drinks, typically if you calculate 55 ml, there are more appropriate calculations. You don't need to do anything. Remember at least a roundup figure of 60 ml of hot drinks. I'll just write in a different color, 60 ml. Okay. 60 ml, matlab 60 ml is a large typically if you order in a pub or anywhere. Otherwise, they call some places small is 30 ml. Two small or one large. They are allowed to drink. Okay. All of you clear, I believe. A beer is a bottle. The beer bottle in India is different. It's, I think, 650 ml. The beer bottle, smaller beer bottles like this Corona Extra or whatever it is, that is 375 ml is allowed per day. Wine, a wine glass, not the bottle, 175 ml is allowed per day. That's 2 units. Clear? Alcohol drinks. So you cannot ask unit. Not everyone will be aware of how much unit he is or she is drinking. But if you ask how much you're drinking, a glass of whiskey or 2 glass of whiskey, 2 glass, small glass, it's fine. He is fine. He can have. Or just I'm just having a glass of beer or just a bottle of beer. Bottle of beer in UK standard is fine, 375 ml. Indian standard is different. That is more than the prescribed unit. So these are the things you need to know about the alcohol. Any doubts till now in history taking? You can ask me before I wind up the session. It's already going to be close to 7. I know it's festival time for most of you. Any doubts till now? You are feel free to ask me. Okay. Any doubts till now? You are feel free to ask me. Once again, somebody personally texted me to post YouTube link, everything where we can see the video. This is the YouTube link and my WhatsApp channel link. You can be there. Yes, the recording is absolutely available, doctor. In YouTube, it is available. It will take some time for me to upload. Right now, I'm also in a travel, like I said, next week, my festival, to a lot of family functions are there. So next week session itself, another doctor will be taking. I will not be taking. So these are the things. Any doubts still now in the history taking? Anything can I do? Yes, 0 is the safe limit for alcohol, doctor, but it's a culture in European countries. You cannot tell 0. Spleen medicine is not available due to some technical difficulties. I will just do it later. Okay. Yes, very good question, Dr. Firdaus. If the person is doing binge drinking, you have to ask about cage questionnaire. Okay. I hope all of you know what is a cage questionnaire. Right, cage. Have you felt the need to cut down? Have you been annoyed? Others telling you are drinking too much, you are a drunkard? Are you feeling guilt? I don't think anybody's feeling guilty. Eye opener. As soon as wake up in the morning, he needs a shot to start his day. That is eye opener. Anything is there, they have to. All right. Any more doubts? Anything you want to ask me, you can ask me. No problem. Next week, obviously, is going to be busy week for everyone. And if there are no doubts, isn't the male has more female serogenic alcohol range? Yes, earlier that was. Now, if you go and say that, that's it. Feminist group will come and rip us apart. Now, men equal to female, they are not inferior to us. Come and rip all of us. You think our liver is bad or inferior to your liver? Alcohol, CLD, stop. Alcohol, hepatitis, stop. Alcohol, CLD, stop. Alcohol, hepatitis, just stop. Stop. Just stop. Anything over 14 units is going to cause cirrhosis at one point of time. Otherwise, daily consumption of 30 to 50 grams over 5 years, it's serogenic. And also type of alcohol. Most alcohol we get in countries like India, like where we live, like that is kind of, to be honest, I shouldn't say acids used to clean. It's mixed. Obviously, it is going to cause cirrhosis and GI bleed. Any doubts, doctor? Any more doubts? Anyone? All right. If there are no doubts, I will close the session right now. And thank you so much, everyone, for attending. Please leave your feedback in my group. I'm more than happy to conduct more sessions in the upcoming days. Next week, we'll be having a very short session only. Maybe another doctor will chip in. If he's not chipping in, I'll just chip in for you. We will do one more case in the renal medicine. Thank you so much. And thank you, everyone. And I will see you all. And I wish you, everyone, a very happy Diwali, the festival of light. May the God of light guide you and sustain you and protect you and give all happiness to you and your family. Best wishes. Happy Diwali. Take care and God bless you all. Bye-bye.